Almost every day I see patients in my practice with digestive complaints. They have tried many things. Several have had medication prescribed. Things just haven't improved much. I take a different approach here. Let me share two success stories. The first story is about a 35-year-old man. He had very painful bloody diarrhea, up to 10 times a day, and he had lost a total of about 6 kilograms. Of course, he was examined. Colonoscopy revealed a diagnosis of ulcerative colitis. He was given a wide variety of medications. The usual medication here is cortisone and immune suppressions. In his case, the medication was Imurec. He told me it didn't improve anything. We used the therapy according to my therapy plan with him. I gave him vitamin D, omega-3 fatty acids, toxaprevent and turmeric. I also added chokeberry extract because turmeric and chokeberry are good anti-inflammatories. It slowly got better. I can't do magic either. It doesn't get better overnight. But after 6 months, his complaints were practically gone. He even gained back the 6 kilograms during this time. We then had to continue his therapy, simply to prevent a fallback. And he also figured out what foods he tolerates and what food he doesn't tolerate. He then switched to a nearly vegan diet. It has been years now, and he's still doing well today. In the first story, I referred to a therapy plan. You will find a link below where you can look at this therapy plan and much more information on the subject of gut health. And now, the second story. I have a 13-year-old girl come to my practice. She was the smallest and lightest girl in her class. At the age of 13, she was 144 centimeters tall and weighed 27.5 kilograms. There are percentiles in pediatrics. Within these percentiles, you compare height and weight with other children. She was at the first percentile. That means 99% of her peers were taller and heavier. Of course, she has gone through many tests before coming to me. They saw several pediatricians, and she was examined at the University Children's Hospital. They never found anything. I've seen the data, and everything that was done and tested. They did an MRI of the skull, they did an MRI of the abdomen, and many lab tests. No diagnosis was found. In this situation, her parents came to me, and I immediately suspected this is a normal irritable bowel syndrome, and I treated her according to the therapy plan that I have already mentioned. And guess what happened? After 3 months, she actually gained weight. Things started to get better rapidly. After about 6 months, she was already 8 kilograms heavier. This weight gain was incredible. After 10 months, she gained 11 kilograms. I recently spoke with the mother again, and she said her daughter is still doing well today. It has been several years now, and she has grown to almost normal size and normal weight. It was just an irritable bowel syndrome, and you could help this child with the simplest of means. Of course, I told you some of my favorite examples. All doctors like to do that. Of course, it does not run so smoothly and so quickly in every case. But what I can say is an improvement of problems can practically always be achieved.